Hey everybody, Dr. Schultz from the Centeno-Schultz Clinic. We're continuing our series on thoracic spine, and today we're going to be talking about the degenerative changes in the thoracic spine. So thanks for checking in, and let's get started. The goals of this presentation are to describe what in the world are the degenerative changes in the thoracic spine, what areas in particular are susceptible to degeneration, and 4 conditions that may be contributing to thoracic spine degeneration. So let's get started, and thank you again. So what are degenerative changes in the spine? They're basically the gradual loss of normal structure or function over time. It's a terrible thing, but it is going to happen to most of us. So let's learn a little bit more about it. So there are many different areas of the thoracic spine, but the 4 that I want to talk about that are particularly susceptible to degeneration are, number 1, the thoracic disc. It's illustrated here. The disc is that cushion or shock absorber that's between the vertebral bodies. There's one at each level of the thoracic spine. It's a very, very important shock absorber, and it's susceptible to degeneration. Number 2, thoracic facet. A facet is a paired joint. It's a very important joint, and it can become injured and degenerative. It's depicted here. This is a posterior approach. This is the spinous process. And as I said, the thoracic facet is both on the right and the left, and it can be injected under X-ray guidance, and it can be a significant source of pain after a motor vehicle injury. The other joint in the spine that you need to know about that's particularly unique for the thoracic spine is what's called the costotransverse joint. It's basically where the rib head comes together with the transverse process, thereby forming a joint. It's called the costotransverse, and it's unique to the thoracic spine, and it's illustrated here. There's one at each level, and here's my pen, but you can see the costotransverse here and here, and it's susceptible to injury and degeneration. And then ligaments. Ligaments are basically the thick connective tissue that connect bone to bone. They can be injured and significantly impaired, really resulting in degeneration. They're depicted here. This is a side view of the thoracic spine. You can see these kind of bony prominences. I call them the dinosaur bones. They're known as the spinous process. And in between each of these are very, very important ligaments. This is the supra right here, and this is the infraspinous ligament. Provides significant instability. So what are the 4 conditions that can contribute to degeneration of the thoracic spine? Number 1, injury to the joints. The 2 ones that we just talked about are the thoracic facet, and the other one is the costotransverse. Just recognize that each of these joints is a pair joint. It's on the left and it's on the right, but equally important, it has cartilage, just like your knee or your hip joint, and that is susceptible to injury and can lead to thoracic spine degeneration. Number 2, here's the costotransverse. This is just a different view. Number 2 is degenerative disc disease. Again, the disc is that shock absorber or wafer between each vertebral body. It's susceptible for injury from either sports, repetitive actions, or trauma like a motor vehicle accident. It's depicted here. Here's a side view of the thoracic spine. The bony building blocks that make up the spine are here and here. And sandwiched in between each of these is a cushion, an important shock absorber that's known as the disc. It is also susceptible to injury. Number 3, a disc herniation in the thoracic spine can take your breath away and give a lot of pain, restriction in range of motion, and some neurologic symptoms. A disc herniation needs to be distinguished from a disc protrusion. A disc herniation is where the contents of the inside are forced outwardly into the spinal canal. This is opposed to a disc protrusion, where there's a simple disc extension out, but it's still contained. It looks like a beer belly. So a disc herniation is extrusion of the contents into the spinal canal, a very inflammatory and painful process. It's usually acute in nature versus a disc protrusion, which can be gradual, but can also be very painful. And then the fourth condition that contributes to thoracic spine degeneration is what's called thoracic spondylosis. It's basically a global degeneration of the many different parts of the thoracic spine. So, in summary, degenerative changes in the thoracic spine are a result of injury to multiple different areas. We talked about those: the disc, the facets, the ligaments, and the joints. The degeneration can be small, but it's the cumulative process that, more likely than not, leads to the degeneration and can keep you or a family member on the side. So how in the world do you minimize the risk of becoming symptomatic with thoracic spine degeneration? It's quite simple. Listen to your body. When you have pain, when you have restriction, when you can't do the things that you want to do, when you can't participate, listen to your body. It's not unlike that red light check engine. You know, you're trying to get out of town on your vacation and there it comes up. It's trying to tell you something. The pain, the limitation that you feel are simply an alert that something's going on that warrants deeper evaluation. And you know as well as I do that treating small problems are better, or it's easier than treating larger ones. So treat the problem when it's small before it becomes a larger problem. At the Centeno-Schultz Clinic, we are experts in the evaluation and the treatment of thoracic spine injuries. There are many treatment options, but it all starts with a thorough evaluation by a board-certified fellowship physician. We take a history, we do a thorough evaluation, physical examination, and an ultrasound guided examination when indicated. There are lots of different treatment options, which include PRP and bone marrow concentrate. Most importantly, you need to be an expert in this field because there are significant complications should the needle go in the wrong place. You can drop a lung requiring a chest tube and or medications for your heart because of collapse. Thank you so much for this opportunity. Avoid thoracic spine degeneration by treating the small problems when they're still small. Thank you so much for your time. See you next week.